I'll get to eat. Was it pretty good?
I got a waffle.
Waffle.
It's pretty good.
Chocolate chip waffle. with
a raisin toast.
Megan, waffle. Good deal.
I already ate mine. It's gone. It was really good.
Gone already. Cool.
Dang it!
All of this.
Oh, there's a leaf there.
And right now, we are doing a puzzle.
Ready?
Wow. We are currently en route to a male subject who's experiencing some difficulty breathing, which could be the result of heart issues such as CHF or possibly a heart attack, or other lung issues such as emphysema, pneumonia, or other related conditions. Once we arrive on scene, we will conduct our assessment, including a 12 lead, and determine what the best treatment for this patient is going to be.
NRV, Rescue 54. Rescue 54 is clear and available. We'll be back on BVRS 1.
A male subject who was having some sudden shortness of breath. We ran an EKG, we didn't find anything, and did all of our other assessments and found nothing that we could fix in the field. Of course, we took him to the emergency department and they did some other analyses there, and we're not quite sure what happened, but hopefully he's feeling better. On the way to that call, our agency got another call to actually the same location for a female subject who had fallen. They also got her to the hospital and we arrived there at the same time, but both patients hopefully will be feeling better soon. The pelvic binder is an important tool to use for individuals who may have fractured or broken their pelvis.
Keep going, keep going. There you go. Wow, my pelvis feels so good.
We are doing the Pedimate, which is a skill that is important when we deal with our pediatric patients. And Katie is practicing, so in case we do have a pediatric patient, we can effectively treat that person and make sure they're safe on their way to the hospital. Backboarding is a form of spinal immobilization used on patients who we think may have a spinal injury. Hare Traction is used for patients with suspected femur fractures.
Blacksburg rescue, Delta response, seizure.
Rescue 52, responding with 3.
Female, not conscious, breathing, having a seizure.
For calls like this, it is important that we ensure the patient's airway is patent, that the patient is breathing, and that they receive ALS intervention or treatment at the hospital for continuous seizures.
A postictal state essentially is when someone wakes up from a seizure. They're usually confused, they can be combative, maybe aren't sure where they are or what's going on. She was in that for a little bit, and then she became alert and oriented ×4. En route to the hospital, the female subject did have a seizure, so we changed our response from non-emergent to emergent, just because in those type of scenarios we don't really know what's going to happen. So she's at the hospital now. Hopefully she'll be feeling better soon and get back to a normal life.
Thanks for watching A Day in the Life of the Blacksburg Volunteer Rescue Squad. For more information about our agency, please visit our website or follow us on the social media links provided in the comments.